Hello friends, I am Dr. Ravul Jindal and today I want to shed some light on a condition that often goes under-recognized but can have very serious consequences. Deep venous thrombosis. Deep venous thrombosis occurs when a blood clot forms in the deep veins of the body, typically in the legs. These clots can impede blood flow, which leads to pain and swelling and in severe cases, life-threatening complications for the patients. When a clot breaks loose and travels to the lungs, it can cause a condition called as pulmonary embolism, which is a medical emergency. Now let's talk about what puts you at risk for DVT and how we go about diagnosing and treating it. Several factors can increase your risk of developing deep venous thrombosis, especially like prolonged periods of immobility, such as long flights, bed rest after surgery, and it all can slow your blood flow into the legs and increase the likelihood of clot formation. There are some surgeries, especially involving the lower extremities or abdomen, like TKR, THR. They can also elevate the risk. Additionally, certain medications, like hormonal birth control or hormonal replacement therapies, as well as conditions like pregnancy, cancer, and some inherited clotting disorder, they all can predispose individuals to deep venous thrombosis. So, diagnosing DVT involves an evaluation, including a physical examination, ultrasound imaging, and blood tests. During the physical examination, we look for signs such as swelling, tenderness, or discoloration in the affected limb. Ultrasound imaging allows us to visualize the veins and detect any blockages which are caused by the blood clots. There are some blood tests like D-dimer, which helps us in assessing the clot risk and it helps us guide the treatment decisions. So early detection is very important to prevent complications like pulmonary embolism, where the clot breaks free and travels to the lung. So prompt diagnosis allows us to initiate treatment and reduce the risk of further complications. Treatment of the DVT typically involves an anticoagulations like blood thinners. These medications help prevent the clot from growing larger and also reduce the risk of its dislodging and causing the harm to the patient. In more severe cases, we do interventions like a catheter-directed thrombolysis or surgery where we actually remove the clot from the body and restore the normal blood flow. It's very essential and important to recognize the signs and symptoms of DVT, and one must seek the medical attention promptly if you have some concerns. With timely interventions and proper management, we can effectively treat DVT and reduce the risk of complications. So guys, thank you for tuning in today. And remember, your health matters, so don't hesitate to reach out if you have any questions and need assistance.